for joining us this afternoon. We appreciate it. Welcome to our members of the media and to those of you who are joining us online. Today, Orange County Mayor Demings will discuss stopping the spread of the virus here as we look at increased COVID-19 numbers. He will also discuss some new testing sites and dates and an update on CARES Act funding. Mayor Buddy Dyer is here as well to talk about masks as well and some testing that's taken place in the city regarding employees. And Dr. Raul Pino from the Florida Department of Health here in Orange County has information, of course, on testing numbers and other important data to pass along to family, friends, and those who need the information. We start with Mayor Demings. Mayor?
Okay, thank you, Dr. Williamson. Thank you to all of you for being here this afternoon. We have quite a bit of information to go through to share with you. What I want to do is I'm going to ask Mayor Dyer, I'm going to ask Dr. Pino to kind of go first because I do believe that some of the information that he's going to provide is going to set the stage for much of what Mayor Dyer and I will say to you this afternoon. We have continued to see a significant increase, a triple-digit increase, sustained in new transmissions of the COVID-19 virus within our community for the last 10 days or so. We have seen that number continue to go up. And so that's very concerning to me. So the previous press event that we did, I shared with you that it will likely require us to take some action. And so when Dr. Pino concludes his comments, I'll come back and I'll share with you some of the actions that we will take here to begin to address the increase that we're seeing. So we'll go with Dr. Pino and then we'll have Mayor Dyer come after that, and then I'll finish it up. So with that, Dr. Pino.
Thank you, Mayor. Good afternoon. Today we have 3,900 total cases accumulative since the beginning of the pandemic. That is putting us at a 3.8 positivity rate. And just to give you a little bit of a reference, the lowest we got was to 2.9. So we basically have increased by a full point. More than 100,000 people have been tested in our county. 98,898 have been negative. And so far, 383 hospitalizations has been required. We have our 48th death. That happened on June 13. Is a female, Latina. The exposure was to a known positive case, and the person didn't have any underlying conditions. I also would like to let you know that, for example, yesterday we received 1,905 test results negative back. We also received 212 positive results. That gave us a 10% positivity rate for yesterday. The day before yesterday, the positivity rate was 11.8. And the day before that day, on the 15th, the positivity rate was 8.2. We also are following a number of outbreaks around the county in many locations. But just to give you an idea, from the 2 weeks that we have analyzed recently, the median age dropped to 29 on the cases for the last 2 weeks, and 42% of all our cases are between the age of 20 to 29 for those 2 last weeks. So the pandemic is getting a lot younger in our county, and it may have to do with some of the activity that we have seen. Also, I know that these outbreaks surrounding the UCF area has gotten a lot of attention because it was published in the media, so I'm not disclosing anything that no one knows or doesn't know. So from that, just to give you an idea, we have identified 152 cases that we can link to the zip codes where we have housing for students of UCF. We analyzed the last 2 weeks anyone between the age of 18 to 35. The median age for the ones that are confirmed to be students from UCF is 21 years old. So all the cases that were related to this outbreak that we could identify as students in UCF have been in the lower end of the spectrum regarding to age. We are following these following outbreaks: 1 in a club, 4 restaurants, 5 bars, 1 grocery store, 1 liquor store, 2 food production facilities, a non-food agricultural facility, a manufacturing facility, and a construction company. So it's all over the place. We have sustained transmission in our county, and it is as simple as wearing a mask when you go out in public. And also, we have seen an increase of the number of cases on people with multi-generational living. So we are seeing older people who have younger people in the house. And in some cases, we can establish the transmission to the younger person coming into the house. So it is critically important that when we have multi-generational living, we protect people who are 65 years and older and have pre-existing conditions. And that could be going through the extreme of having the person masked while they're in their house, not doing things that don't require a mask if people are going to be coming in and out of the house. We also are following an outbreak in a healthcare facility that has 40 residents, long-term care facility. 16 of the residents has been affected by the pandemic, 5 of the employees. And I want to thank the EMS services from the county who alert us that they have transported a few individuals from that facility, because at the time that we were notified by EMS from the county, we didn't have any knowledge of any case in that facility. So thanks to that, we were able to act very quickly to stop transmission and to provide the facility with the services that they need. If you have later questions about what steps we have taken, I will be informing you of those. Thank you. Mayor.
Thank you, Mayor Demings. Dr. Pino, as Dr. Pino has made clear, the virus is not only still here in our community, but it is expanding in our community. Since I notified you yesterday at our testing site about positive tests within the Orlando Fire Department, now we have a total of 28 Orlando firefighters who've tested positive for COVID-19 or in mandatory 14-day isolation. And out of an abundance of caution, we have additional members of OPD who are also on a 14-day quarantine, and they're being tested, those that have come in contact with the other 28. Additionally, we were notified today that 2 Orlando police officers have tested positive. They're also in a mandatory 14-day isolation, and there are additional members of the OPD that will be in mandatory 14-day quarantine as well. So that all shows that while we may think we're done with the virus, we must remember the virus is not done with us. The virus continues to be heavily transmissible through droplets in the air. That means not only from coughing and from sneezing, but from simply talking, and especially loud talking and laughing and singing. And this is especially spread easily in indoor spaces where people congregate for extended periods of time. So no one is immune to coming into contact with the virus, so we must not behave as if we are. I know it's hard for me too. Wearing a face covering when it's 90 degrees outside is not comfortable, and it's especially difficult during these summer heat. But all of us together, we must not let our guard down. We can't take the easy way out. We can't be complacent. We have to remain diligent. And it remains just as critical today as it has been for the last several months to continue to wear face coverings whenever you're indoor spaces, and you need to continue the 6-foot social distancing when possible. Mayor Demings is going to discuss an executive order that he is issuing on a countywide basis We're supporting that. It will cover the city of Orlando as well. We don't plan to issue a separate order. We will just simply comply with the order that Mayor Demings is going to discuss. I pledge that I will continue to do my best to keep you safe by wearing my mask and physically distancing, so I hope that you'll do the same. Also, we want to encourage our residents to continue to get tested when they can. More testing and accurate numbers helps us identify potential outbreaks, as Dr. Pino just discussed. We will continue to stand up testing in our neighborhood centers on Wednesdays from 10 to 2. So far, we have tested close to 1,600 residents. Every Friday before testing, appointments will be open online. Next Wednesday, the 24th, will be at the Northwest Center. Wednesday, July 1st, will be at the Smith Center. Testing is free. No symptoms are necessary. All you need to have is an Orlando or Orange County ID and be 18 years or older. Thank you. Mayor Demings.
All right, thank you, Mayor Dyer, and thank you, Dr. Pino. You heard some of the sobering news today. In a 24-hour period, we had 316 new positive cases here within our community. While the testing has continued here within Orange County, we've now tested over 100,000 people. And you heard most recently that rate of positivity in terms of day-to-day has increased to double-digit levels. We are still in fairly good shape in that our hospitals have not exceeded capacity, albeit they are seeing slight increases in the number of visits to the ER and patients who are being admitted into various hospitals related to testing positive for COVID-19. So it's concerning to me. A few days ago, we said to you that we were going to monitor this, and we were very optimistic that even though we have increased testing within our community, we would continue to see the numbers remain low. That is not the case. So as a result of that, I have signed an executive order requiring every person working, living, visiting, or doing business in Orange County to wear a facial covering consistent with the CDC guidelines while in any public space. This will go into effect on Saturday, June the 20th at 12:01 a.m. until further notice. The executive order is in the best interest of all businesses, especially bars and restaurants. I will tell you, we do not want to experience another shutdown within our community. So what we're doing, this is a measured approach. It's not a good option for us as a community to do nothing when we see the numbers continuing to climb. So as a result, we are putting a mandatory order in place requiring the wearing of face masks. If the trend continues, where we continue to see increased triple-digit numbers, if you will, on a day-to-day basis, if we see where we have a significant increase in the numbers in people in our hospitals, those two things will trigger something else. Now, I realize that Governor DeSantis is committed to reopening Florida. We are committed here within Orange County to maintaining our business commerce and having businesses remain open. In order for us to do that, however, we need the assistance of every person who is living here within our county, who is visiting our county, going out and patronizing our businesses. So this is a measured approach to bringing about the kind of desired results that we want to see within our community, not one that we relish doing, however. Just yesterday, the Orange County Convention Center's drive-through testing site conducted a record high of 1,021 tests in one day. Now, keep in mind the Orange County Convention Center site is supposed to be a regional test site that is being managed and operated by the state of Florida with the support from the National Guard, et cetera, there within that facility. Normally, they anticipated testing no more than 750 people on a daily basis, but they're exceeding that because what we're seeing is people in our community have this desire to be tested. If they feel a little under the weather or what have you, they're going and they're being tested. You heard Dr. Pino share with you that the age is getting lower. The recent numbers indicate, Dr. Pino, did you say 29? The age of 29. If you put that into perspective, that number before was in older people, 60 plus years old. The average was 60. Here we are at 29. So we know with the demographic of those individuals who are young adults between the ages of 20 and 39, it's problematic for us in terms of the new numbers that we're seeing. So we're going to have to put an increased emphasis on making certain that that demographic begins to wear a mask in greater numbers, et cetera. Next week, we look to do additional testing in some of the zip codes that have stood out for us. On Monday, the team will be at the Farm Worker Association of Florida in Apopka. On Tuesday, a site location will be available at the John Bridges Community Center in Apopka. And on Wednesday, June 24th and Thursday, June the 25th, we will have a site open at the Neighborhood Center for Families in Zellwood. So we'll be focusing in that northwest area of Orange County. We also will have a testing site at the Legacy Middle School that will open next Monday through Thursday, and you can make appointments for these sites. You can do so by going to our website at ocfl.net / COVID-19 to make appointments. What we want to do, if we're going to require people to wear a mask, we also want to make certain that we, where there's a deficit of access to masks, we want to provide masks within our community. So next Wednesday, June the 24th, Thursday, June the 25th, and Friday, June the 26th, we will again offer the opportunity for our small businesses with 40 employees or fewer to pick up packets of free personal protective equipment. This PPE kit will include 200 disposable face masks, 15 cloth masks, and 20 bottles of hand sanitizer. The locations where they can be picked up will be Downey Park, the South Orange Youth Sports Complex, and the West Orange Park. Again, if small businesses, 40 employees or fewer, would like to receive the free PPE, they can also register by going to our website at ocfl.net/PPE. Again, ocfl.net/PPE. Want to give you some feedback about how the funding is going for crisis assistance here within the community. Back on June the 8th and 9th, we opened up our portals here through the Orange County website for individuals who needed assistance with the payments of rent, utilities, medical bills, etc. You all know that on June the 8th and 9th, on those 2 days alone, we had over 52,000 people that accessed our portal looking for information about the crisis assistance. Of that number, 3,501 actually completed all of the paperwork for the assistance. 196 individuals were denied because of various reasons. That means that approximately 3,200 individuals are being processed and have been notified of their status. We believe that the overwhelming majority of them are eligible, and that would be a cost to the fund of about $3.2 million. So I wanted to give you that feedback. The checks primarily will be cut by the comptroller's office and will be mailed to those individuals. In addition to the families and individual crisis assistance, we expect to reach about 5,000, process about 5,000 applications by the end of next week that's not right. That's 5,000 applications by the end of next week for the individual families applications. We should process 5,000 by the end of next week. In terms of the business assistance, this is where we are providing the $10,000 grants for small businesses. Currently, a little over $7 million have been approved for payments to Orange County small businesses. Those are small businesses with 25 or fewer employees. There are a total of 4,063 applications that were submitted for that process, and so that process is going fairly well. We do have some staff that's here if you have any questions about the business or the crisis assistance that could respond to your specific questions. So with that, let me stop and open it up for any questions that you may have.
Hi, this is Eric Sandoval with News 6. Mayor Demings, a question for you. Actually, a pair of questions. Number one, why didn't you make this executive order take effect immediately or maybe tomorrow and wait a day? And number two, have you talked to the governor's office at all about your decision to require masks?
What we did, we provided some correspondence to the governor's office of what we're doing here and suggesting to the governor that he may want to make the wearing of masks mandatory throughout the state of Florida. And so we'll wait for his response from that. And why are we waiting to Saturday, 12:01 a.m.? I want to give people adequate notice. Secondly, we want to make certain that with that notice comes the opportunity to have access to the PPE. So whenever you put mandatory orders in place, I think that a period of time for notice is appropriate. We do want compliance. We don't want to enact orders that people don't have the ability to follow. So this is why we have made the decisions that we made.
Mayor Robert Guadarrama, Fox 35. Let's talk about enforcement. What will enforcement look like to make sure folks do comply with this mandate? And then my second question is, what will this look like in restaurants and bars while people are eating and drinking?
Okay, we'll take the last part of that first. What will it look like? I believe that our expectation is that where you are congregating in places where you can't adhere to the social distancing guidelines, where you're in immediate proximity of multiple people or crowds for extended periods of time. We know that in the cases of bars or restaurants, people have to eat and they may have to take their mask off. But the expectation is that the employees will continuously wear their masks and that the individuals who are going there, they may enter with a mask, and if they're not eating or doing other things, and they're just congregating and socializing, then they should be wearing their mask. Obviously, Dr. Pino talked to you a little bit about some of the, I'm going to say, bar-like locations or bars in the area of the University of Central Florida, and the outbreak that we have seen around some of them is because they were young, invincible in their minds, and they weren't wearing masks, and so there's an outbreak associated with that. So in terms of the enforcement piece, we want voluntary compliance with this. We have been deliberate at this phase of not saying that it carries a criminal penalty, because that's not the goal that we're trying to do. I believe that in the world that we live in now, with the potential conflict between law enforcement and the community, we're certainly not trying to create an environment where we want law enforcement to get into enforcing what I call maybe minor violations of law or rules. Well, that's not our goal here. Our goal is to gain voluntary compliance, and so these are measured approaches to that. If we get complaints about a particular location that is not adhering to the order or the guidelines that's being put in place, then we will look within the different options that we have to respond to that. I believe that as Dr. Pino and the Department of Health does contact tracing, I believe that where you can point back to a specific location, I would imagine you're going to start to see some of his staff that will be investigating and visiting those locations to try to bring them along, to help them comply. Perhaps some may say that they don't comply out of ignorance to what they're doing. Perhaps some just don't believe in the medical science behind this, and they are just disagreeable to fall in direction. But we believe that in this community, the overwhelming majority of people get it. They understand what we're trying to do, and this is something that we're going to have to do for a prolonged period of time until such time there's a cure or there's a vaccine in our community. In other words, we have to live with the virus among us, and this is a way that we're able to live with that virus among us.
Lauren Seabrook, Channel 9. This is for you, Mayor, and for Mayor Dyer. With tomorrow being a night that a lot of people go out on a Friday night, and it's not starting until Saturday, have you all spoken to or thought about speaking directly to some of these bar owners, especially downtown, to say, you know, we've got a problem here and we really need you guys to take some ownership and not just let these kids come in without masks and party together?
Yeah, Mayor Dyer, if you want to take a stab at that first, and then
Sure,
I'll
we're in
follow.
constant contact with bars and restaurants, both in our downtown and our 10 Main Street districts. We've provided them with masks to distribute in the Main Street districts, but we are constantly talking to them about adhering to the social distancing and wearing masks. And that's who we're going to talk to, is we're going to go talk to the owner or whoever the manager is. We're not going to be trying to enforce things against bartenders or patrons. We're going to talk to the establishment owners and encourage them to make sure their establishment is a safe one. And quite honestly, I would say to the public, if you're in an establishment where they're not practicing social distancing and wearing the mask, don't go there. You know, that's the best way to get adherence, is if you don't patronize the places that aren't following the rules.
And I will say this, we depend on you, the media, to help us spread the word, but I remind you that businesses are reminded through Executive Order 2020-12, it requires that both employees and patrons to be within 6 feet, must wear a face mask or covering unless the wearing of the patron's face mask or covering would impede the patron's service, in which case only the service provider must wear a face mask or covering. So all businesses are encouraged to prohibit entry of each person who is not wearing a face covering, with the exception of those who we enumerate here. There are certain types of businesses, daycares, where children who are 2 years old or younger not required to wear a mask, etc. So we want voluntary compliance to the extent that we can, and we'll evaluate. If we don't get that, then we have to look at other measures. So it's a phased approach that we have here. Hopefully the citizens understand that this makes sense to some degree of what we're doing here. Any other questions? Hopefully we answered it. Yes.
Yes, this one's actually for Dr. Pino.
Dr. Pino.
Dr. Pino, Ryan Gillespie at the Orlando Sentinel. A few minutes ago, you named quite a few outbreaks that you guys are working on right now. Are those all recent outbreaks in the last couple of weeks with this spike? And then also specifically the long-term care facility you mentioned, I know you've said probably been a month at this point, that's kind of your biggest nightmare. What's the kind of the seriousness of that situation?
So with regard to outbreaks, the public understand, we don't close an outbreak even if we have no cases until we have 2 complete cycles without cases. So it could be that a place had the last case last week, we will not close that until we complete 2 cycles of transmission from the last case, meaning we give the ample time to other cases to come up. So that's why we don't close. Some of those are in that category. We haven't seen any, and but we're still waiting for the 14 days. So with regard to the long-term care facility, I visited myself. We have some concerns, and I was very, very concerned Monday and yesterday. Today, a little bit better, feeling a little bit better about it. Part of it, we went there, we learned on Monday of the issues that the place was facing. We sent our staff on Monday. On Tuesday, we tested everyone, including the employees. On Tuesday afternoon, the infection control nurses from the state were at the place to review the practices and see if we can find, where the issues are. Today, they are there from 7 in the morning to 7 p.m., and tomorrow the infectious disease nurses will be there from 7 in the morning to 7 p.m., just observing the staff, how they are conducting the daily business, so that we can, highlight areas that may need improvement. Also, we guided the company to hire a staffing firm that can come and supply staff as their staff goes in isolation and quarantine. And we also arrange, and when I say we, it's not just, the health department, but a group of people working on this. We also arrange for all the positive cases that didn't need hospitalization to be transported to a facility, a step-down facility that have better conditions for care that these individuals may need. And then on Monday, we were doing a second round of testing to all the patients and all the staff again to see if we pick any asymptomatic individual. So those are the things that we are doing at that place.
Hi, Eric Mock, Spectrum News 13. This question is for Mayor Demings. And Mayor Demings, so just a quick clarification on the mask order. Does that apply to people running or exercising outdoors? And then just another one, if I may, just how much longer or what benchmark are you looking to get before you would institute more shutdown orders here in the county?
So the order exempts people who are actively engaged in exercise, so they would be excluded. Again, for me, I hope we don't get to the point where we're going to do shutdowns. That would not likely happen, I think, in Florida, unless we get to a critical point where we are approaching exceeding the capacity of our hospitals and healthcare systems. I believe we're a long ways from that at this point. We don't want to get there. That's why we're doing what we're doing now. So this order will remain in effect indefinitely. So we're buying time until, again, there's either a cure or there's a vaccination that exists. So we're buying time with this measure.
This next question is text in from Alexa Lorenzo from WFTV. It's for you, Dr. Pino. Can you describe what does the current recovery rate look like right now for those cases you've discussed?
I don't have it in front of me, but I believe it's 66%.
Thank you. This next question is for Mayor Demings from Doug Kaplan with OrlandoPolitics.com. He says, President Trump waited to the end of May to shut down travel to Brazil almost 2 months later than Europe. Do you think the fact that people from Brazil that are having 10,000 cases of their own a day were able to travel here until the end of May is one of the reasons for the increase of COVID infections in Florida?
I have seen no data to support that. I'm not an epidemiologist, but I talk daily with Dr. Pino and his staff. And I believe that he would concur that the overwhelming majority of new positive cases that we see, they're related to people who live here. They're not people coming from somewhere else infecting us. It's people here who are not doing what they need to do to protect themselves and others.
This next question is text in from Melissa Thomas with Florida National News. Given the governor's push for schools to close for the primary and general elections, are there precautions and preparations in place in Orange County to prevent what happened in Georgia's primary, both in terms of voting procedure and COVID-19 safety?
I have the utmost confidence in our supervisor of elections, Bill Cowles, who is part of the state consortium of other supervisors who have contingency plans in place to be able to ensure individuals will be able to safely vote. I believe that the vote by mail process is going to be one that will likely increase turnout within our community itself. But in other words, they're planning for all of that to have a successful voting process.
This next one's from Ryan Lynch from Orlando Business Journal for you, Mayor. What other additional measures might the county look at to prevent additional spread past the mask requirement?
I believe Dr. Pino talked a couple of weeks ago about getting people immunized against the influenza. I think in terms of a broader strategy, we want to make sure that our community is as healthy as it can be, so making certain that people get those vaccines that are available is part of it. Two, I think our strategy of making certain that we have adequate testing opportunities within our community so that individuals who are positive can be tested, they know they're positive, and they can take appropriate sanitary measures and do what they need to do to stop spreading it to their families or to other people. Three, we have been pretty focused on ensuring that adequate PPE is distributed within our community to help reduce the probability of the spread of the virus within our community. So all of those things have happened. We have a public awareness campaign that we'll be rolling out soon that will be targeted to specific demographics where we are seeing the surge in the numbers. So we'll talk about that next week. We have staff working on that, working with some of our local media outlets, and so we'll roll that out across the region here within Central Florida. So multiple things are being done, I think, to better position us to be successful in reducing the spread of the virus.
And this last one I have is for Mayor Dyer. This comes from Shannon Butler with WFTV. Can you please address what the city is doing now with the 28 firefighters that have tested positive and the 87 that are being quarantining, what that looks like?
Well, it means they're isolated. Some of their circumstances might be different, but that means they're totally isolated for 14 days, as well as some of the people that had come in contact with them. So we did contact tracing. A number of them are our new hires that were coming on. So it does affect some of the manpower at the stations, but for the most part, we've got everything covered.
And so since we do have members of the Spanish-speaking media who are here, we will go ahead at this point. If you have questions that you want to ask, we'll do that. I'll ask Ms. Ilia Torres to come forward, and we can provide brief recaps. And we have Commissioners Myra Uribe and Commissioner Maribel Gomez-Cordero who are here as well. They have been working with the county to make certain that all segments of our Spanish-speaking community get the information that is needed. So,
William Díaz, es para la comisionada Maribel Gómez Cordero. Una persona en el distrito 4 del condado tienen una institución educativa y desean saber si ellos pueden reanudar las clases. Los salones serían hasta de 12 personas observando distanciamiento social y si hay algún otro tipo de restricción diferente a la mascarilla y también el hand sanitizer?
Gracias, William, por esa pregunta. Ellos tienen que seguir la guía del CDC y yo creo que una de las cosas que recomendamos siempre es que cojan las temperaturas, ya que son estudiantes. A veces, acuérdate que si no tienen los síntomas, pues pueden entrar y pueden contagiar a los demás. Coger la temperatura. Deberían de tener afuera cuando vayan a entrar algún pote de hand sanitizer para cuando entren y cuando salgan y medir las distancias, como dice el CDC, para que puedan, ¿verdad?, seguir toda la orden y no se contaminen unos al otro.
¿Cuál sería el número permitido?
Eso depende de lo grande del salón, o sea, depende del grande del salón, es que toman las medidas y sientan a los estudiantes. Pueden ser 12, puede ser 15, pero depende del salón. ¿Cómo no?
Buenas tardes, Alibet Suárez. Mi pregunta, con más 100.7 FM, mi pregunta es, ¿hasta cuándo será obligatorio el uso de la mascarilla? Y, por supuesto, con esta orden ejecutiva, ¿y cuáles son las sanciones que se le darán a las personas que no la utilicen?
¿Y la pregunta es para el alcalde?
Sí. Gracias.
The question is, for how long will this executive order of the mandate of using masks will be instituted? And what was the second portion, Ellie?
La segunda es, ¿cuáles sanciones se le darán a esas personas que no utilicen la mascarilla?
And the second question, what will be the sanctions for those who are not wearing or following the mandate of using masks?
The executive order takes effect at 12:01 a.m. this Saturday, and it will remain in place for an extended period of time, unspecified.
La orden del mandato de utilizar mascarillas entra en vigor el sábado a las 12:01 de la mañana y estará en efecto por un periodo de tiempo extendido que no tiene determinación al momento.
At this point, there are not criminal penalties associated with potential violations.
En este momento no hay sanciones criminales para aquellos que no utilicen las mascarillas.
This is the step where we are at this point. If we see broad compliance, there will not be a need to move to a phase where we institute criminal sanctions.
Este es el paso que adoptamos en este momento. Si vemos cumplimiento, pues no vamos a necesitar adoptar medidas o sanciones criminales.
For us, that is the last thing that we want to do is to put penalties, monetary or incarceration associated with this.
Lo último que queremos hacer es imponer penalidades de cárcel o pecuniarias.
Un par de preguntas para el doctor Pino, Edgar Carrillo de Telemundo. Cuando hace minutos afirmó que el virus está en todos lados, queremos escuchar un poco más detallado esa afirmación, porque la gente, o mucha gente, pensaba que ya había pasado lo peor. Entonces, como un llamado de conciencia, ¿no?, cuando decimos que está en todos lados. Y lo segundo es, ¿qué tanto se le puede atribuir a los recientes días de protestas que hubo en el downtown, donde muchos de nosotros estuvimos y comprobamos que era mucha gente joven la que estaba ahí presente, a este repunte de las estadísticas?
Mira, con respecto al que el virus está en todas partes, nosotros siempre alertamos cuando estábamos en números muy bajos que por favor no ignoraran el hecho de que todavía la pandemia está en efecto. Y sabíamos que se iba a incrementar con el incremento de la actividad social, pero el incremento que hemos visto es inmenso. No tiene proporción con el incremento de la actividad social. Se debe a otros factores. Y el factor que yo pienso que ha sido más importante es el factor de los jóvenes, las personas más jóvenes, cuando abrieron los restaurantes a más capacidad y los bares, y las demostraciones también. Ahora, nosotros no hemos podido todavía decir, aquí en esta demostración fue donde se adquirió. No lo hemos podido verificar aún. Pero creo que es prudente, teniendo en cuenta el número de casos y también en la disminución en la edad de atribuir algunos de esos casos a las protestas. Teniendo en cuenta cuando empezaron las protestas, esos casos los debemos ver la semana que viene si comienzan a pasar. Yo personalmente entrevisté, no anoche, la noche anterior, por teléfono a muchas de las personas que tuvieron hice 30 entrevistas antenoche a personas que han sido positivas. Todos jóvenes, todos muy conscientes de que cometieron un error y de que fueron irresponsables en el sentido de que pensaron de que el virus se había ido y no se protegieron adecuadamente. Afortunadamente, de manera muy general, los jóvenes no tienen grandes consecuencias y desde ese punto de vista estamos menos preocupados.
Okay, if there are no other questions, then we'll conclude the press conference. Feel free if you want to do a one-on-one with any of the commissioners or Dr. Pino or myself. We're here available to do that. But thank you for being here.